All right, now on your feet at 5, Governor DeWine says more young people are going to the hospital for COVID-19. He said more people 50 and under are going to the hospital now than at any other time in this pandemic.
And the main reason why? They are not vaccinated. Our senior health correspondent Monica Robbins joins us now. And Monica, I know that you talk more and more about the vaccinated versus unvaccinated. You'll get to that a little bit more in just a minute. But how are the kids doing?
Yeah, not so good right now. Yeah, according to Health and Human Services, Ohio is 5th in the nation for the number of hospitalized kids since the beginning of July. Akron Children's just broke a single-day record of cases today with 20. 28% of those in the pediatric ICU are COVID patients, according to their chief medical officer. Now, since July 1st, HHS data shows 576 kids have been hospitalized with COVID, and cases skyrocketed since September 14th across the state. Now, Northeast Ohio hospitals are already changing visitor policies, going back to those stricter measures. Still, the majority of those needing hospitalization, like Betsy said, are unvaccinated.
From an admissions point of view, 2/3 of the kids are over 12. So the admissions are kids that could have been vaccinated, but most, in fact, I think most all have not been vaccinated, either weren't eligible or opted not to get that. So the outpatients are predominantly the younger kids, and they're sick, but not so sick that they require hospitalization. They can be managed in the outpatient area.
So meanwhile, the governor today discussed the sharp rise in hospitalizations, saying today's number of 459 is the highest number of hospitalizations since January. And he added that 97% of those hospitalized are unvaccinated. And last month, preliminary data showed an average of 2 people younger than 50 died of COVID in Ohio every day. Last month, 18 people under the age of 39 died.
Wow.
So this is getting really serious, and I hope people are getting the message, and it's really time to get that vaccine.
All of our stories here in the last couple of weeks have had one theme. The unvaccinated are getting sick. The vaccinated, for the most part, have escaped either getting the virus or getting any of the symptoms and having to go to the hospital. I want to ask you a quick question about the boosters, because that was in the news last week. J&J is doing their own research and their own data that they're putting together to try to apply for a booster. Where are they on that?
Yeah, J&J just released their preliminary data today. They're saying that they're studying a 2-dose version of their one-shot vaccine, and the company says the double shot is as effective as the Pfizer and Moderna shots, coming in at 94% efficacy. J&J submitted their data to the FDA, so if the FDA signs off on it, those who receive the single dose may be able to get a second dose probably in the next few months. And again, it comes back to whether or not boosters are approved. We'll have to wait and see.
And there's still no word yet on crossing over to a different version of the vaccine.
Somebody asked me about that today. Yeah, they're studying that.
Right.
Initially, it does look like the mRNA vaccines, it's possible, but we're still waiting for the official data to come out.
So stay in your lane.
Stay in your lane right now.
Great. Thanks so much, Mike.
Sure.